I entitled this video The Disappearing Lip because I've had maybe once a week someone coming in for a lip filler because they say when I smile, my top lip disappears. And I tell the patient if your top lip doesn't disappear, it actually is a sign of a fake lip, with a few exceptions. So I'll explain that. So generally speaking, a lip should flatten and virtually disappear during smiling. When it stays full, especially round, it is a sign of an overfilled lip. There's a great example that I use. I have a picture of Christy Turlington that was posted on an Instagram post of how naturally she ages. And I use this all the time to show how actually unnatural she is because her top lip is rounded in appearance. It doesn't flatten out during a smile. And second of all, when she smiles, her Botox is pretty good up here, but terrible down here with advanced lines. If you want to hear more about those other concepts of total balance, you can sort of listen to my videos about dynamic fillers. You can listen to my video about meso-Botox and just understanding how to balance the lower 2/3 of the face, the upper third of the face. But one of the reasons she looks artificial is that her lip stays in a rounded configuration during smiling. So you really do want your lip to disappear virtually during a smile. That is normal. Now, what are some exceptions? There are two major exceptions to a disappearing lip. Ethnic lips, lips that are very, very full. So if you're African American, I do lip reductions as well, but also, for both ethnic lips as well as over injected lips. But I found that ethnic lips don't disappear as much, or the very young patient. So if I've got someone, a teenage or early 20s, it doesn't disappear. However, there's an appearance of the lip that still looks natural on an ethnic lip and a younger lip, in the sense that the lip still looks stretched and attenuated or thinned out. It just may not fully disappear. So the one thing is I encourage you to stop looking at your lip disappearing as a reason to do the procedure. And the other reason why is to get the lip not to disappear, you have to put too much filler in a static phase. In other words, when you're not moving it, to try to get the compensation for when you smile to be corrected. And so that means when you don't smile, it looks too big in order to try to make this disappearing lip look possible. So you don't want to fix a lip where you're not smiling. You don't want to fix the lip when you're smiling and create a problem when you're not smiling, because you have to overfill it to make it not disappear. And as I just said, in my eyes, a lip that doesn't flatten correctly when you smile is also a sign of a fake lip, but probably you won't notice it. But my eye is so darn critical that I see everything. Great example is a lady yesterday that I was doing some meso-Botox for her, which if you don't know what that is, I have a 25-minute video on that called Meso-Botox. It's a very popular video, you can look at it. But she says, oh, I hate fake lips. And so she said, could you put a little bit right here? And I said, I hate to tell you, your lip is fake. And the problem is your central border. And that's the funny thing is you oftentimes my patients are obsessed with not looking fake, and then they don't even know they actually look weird. But this is a video just to have you understand. I actually did a blog on this. It was Nicole Kidman. I remember seeing an old photo. I did a blog called The Disappearing Lip about maybe 10 years ago. Just haven't really updated in a video format and really articulated it. But that is something to understand, is lips should, and non-ethnic lips should somewhat disappear, and that's normal.